Have you ever stood up and felt a strange numbness shoot down your leg? Or maybe there's a dull, burning pain that starts from your lower back and creeps all the way to your foot. For seniors over 50, it's easy to brush this off as just aging, or maybe I slept wrong. But what if this isn't just normal wear and tear? What if your leg numbness is the early sign of something much more serious, like sciatica, or even a herniated disc that's pressing against your spinal nerves? Here's the scary part. These conditions often go undiagnosed for months, sometimes years. And by the time most people realize what's happening, the damage has already begun, affecting their mobility, independence, and quality of life. In this video, I'll break down the real differences between sciatica and a herniated disc, how they affect your legs after 50, and what symptoms you should never ignore. Because knowing what you're dealing with could be the difference between full recovery and permanent nerve damage. Let's get into it. Sciatica isn't a condition, it's a symptom, and it starts with one of the longest nerves in your body, the sciatic nerve. This nerve begins in your lower back, runs through your hips and buttocks, and travels all the way down each leg. When something compresses or irritates it, that's when the trouble begins. For seniors over 50, sciatica becomes more common for two big reasons: spinal wear and tear and poor posture over time. As we age, the cushioning between our spinal vertebrae begins to shrink or degenerate. This can lead to narrowing of the spinal canal, a condition called spinal stenosis, or even direct pressure on the nerve root. What does it feel like? Most seniors describe it as a sharp, stabbing pain in one leg, usually worse when standing or sitting for long periods. Some feel a tingling or pins and needles sensation. Others experience weakness that makes it difficult to lift the leg, walk upstairs, or even drive. And here's what makes sciatica tricky. The pain doesn't always start in the back. Sometimes the first sign is numbness in the foot or a burning sensation in the calf. That's why it's often missed or misdiagnosed until it's advanced. The key takeaway: if you're over 50 and feeling unusual pain, tingling, or numbness in one leg, don't wait. Your sciatic nerve might be trying to tell you something before things get worse. Now let's talk about herniated discs. Imagine the soft, jelly-like cushions between your spinal bones. Those are your discs. Their job is to absorb shock and keep your spine flexible. But with age, these discs begin to dry out, weaken, and become more vulnerable to damage. When one of these discs bulges or breaks open, it's called a herniated disc. And if that bulge pushes against a nearby spinal nerve, you're going to feel it, sometimes instantly, sometimes over time. For seniors, this often shows up as sharp, localized pain in the lower back that radiates down one leg. But here's where it gets tricky. Not all herniated discs cause pain right away. In fact, many people walk around with one for years without realizing it, until they bend, twist, or lift something and suddenly can't move without shooting pain. So how do you know it's a herniated disc and not just a pulled muscle? Listen to your legs. A herniated disc often causes weakness in specific muscle groups. You might have trouble lifting your toes, standing on your heels, or maintaining your balance while walking. Some seniors even report numbness in the thigh or groin, signs that nerve compression is already affecting function. And when it reaches this point, ignoring it is no longer an option. This isn't just a sore back. It's your body warning you that pressure on your spinal nerve is compromising your movement, your strength, and possibly your bladder and bowel control. That's when you need to act fast. The earlier a herniated disc is identified, the more likely it can be treated without surgery. So what's the difference between sciatica and a herniated disc? They're closely connected, but not the same thing. Think of it like this. Sciatica is the fire, and a herniated disc is often the match that lit it. Sciatica is a symptom, a shooting, burning, or numbing pain that runs along the sciatic nerve. It can be caused by a herniated disc, yes, but it can also come from spinal stenosis, bone spurs, or even muscle tightness that presses against the nerve. A herniated disc, on the other hand, is a physical condition. It's the actual bulging or rupturing of one of your spinal discs, and it may or may not cause symptoms. When it does, it can result in sciatica, but also back pain, leg weakness, or other nerve issues depending on where the disc is located. Here's how to tell them apart. Pain location. Sciatica usually affects one side and radiates down the back of your leg. A herniated disc may cause pain in the back itself or even the hip and groin. Numbness or tingling. Sciatica tends to follow a clear nerve path down the leg. Herniated discs may create broader patterns, affecting different muscle groups. Onset. Sciatica can come and go with activity. A herniated disc may trigger a sudden, intense episode, especially after lifting or twisting. Knowing the difference matters, because treating a symptom without addressing the root cause is like putting a bandage over a leak. You'll get temporary relief, but the problem will keep coming back. Millions of older adults experience occasional leg pain or back stiffness. But how do you know when it's something more serious, something that needs medical attention right now? Here are 3 warning signs you should never ignore, especially after the age of 50. 1. Sudden or progressive leg weakness. If your leg starts to feel unstable, you're dragging your foot, or you suddenly can't lift your toes, this is not normal. It's a sign the nerves controlling your muscles may be under serious pressure. The longer that nerve compression continues, the higher the risk of permanent damage. 2. Numbness in your saddle region or inner thighs. If you notice tingling or numbness in the area between your legs, your buttocks, or down the inner thigh, this could point to something called cauda equina syndrome. It's a rare but dangerous spinal condition that can lead to loss of bladder or bowel control if not treated fast. This is a medical emergency. 3. Pain that doesn't go away or gets worse with rest. Pain that persists for weeks, especially if it radiates down one leg, worsens at night, or doesn't improve with stretching or rest, should not be ignored. Many seniors make the mistake of waiting it out, but this delays diagnosis and treatment and makes recovery harder. Bottom line, your nerves are trying to communicate. If you start to notice these red flags, it's not overthinking, it's proactive health. Because early intervention means better results, fewer complications, and more years of independent living. So when exactly should you see a doctor? Here's the truth. If leg pain, numbness, or back discomfort lasts more than 2 weeks, or if it's interfering with your walking, balance, or sleep, it's time to stop guessing and start investigating. A good doctor won't just ask about your pain, they'll test your strength, reflexes, and nerve function. These simple checks can reveal if a nerve is compressed or if you're losing coordination on one side of the body. From there, imaging tells the rest of the story. X-rays are often the first step. They show the structure of your spine, things like narrowing between vertebrae or bone spurs, but they can't show nerves or soft tissue. That's where MRI comes in. It's the gold standard. An MRI reveals whether you have a herniated disc, spinal stenosis, or inflammation around the sciatic nerve. For seniors, this scan is especially helpful because it can uncover multiple issues at once. Some doctors may order electrodiagnostic tests, like EMG or nerve conduction studies, to see how well your nerves are working. These tests are painless but powerful. They detect if the problem is coming from your spine or if it's something like peripheral neuropathy caused by diabetes or poor circulation. The key message? Don't wait until the symptoms become unbearable. The sooner you know what's wrong, the more options you have, most of which don't involve surgery. And most importantly, the faster you act, the less chance your nerves have to suffer long-term damage. If your symptoms are mild to moderate and you've ruled out emergencies, there's good news, you might not need surgery. In fact, many seniors find real relief using simple, science-backed strategies right at home. 1. Gentle stretching, especially hamstrings and piriformis. Tight hamstrings can worsen sciatic nerve pressure. Try lying on your back, bringing one leg toward your chest and holding for 20 to 30 seconds. Piriformis stretches, like the figure 4 stretch, can also reduce nerve tension deep in the hip area. 2. Heat and cold therapy. Use an ice pack during the first 48 hours of pain flare-up to reduce inflammation. After that, switch to a warm compress or heating pad to relax muscles and improve blood flow. Many seniors alternate both, depending on what feels better. 3. Anti-inflammatory nutrition. What you eat affects your nerves. Turmeric, leafy greens, omega-3 fats from fish or flaxseed, and magnesium-rich foods like spinach and almonds help reduce inflammation. Also, stay hydrated. Dehydrated discs lose cushioning power fast. 4. Low-impact movement. Walking water aerobics, and gentle yoga promote circulation and prevent stiffness. Sitting too long can make nerve pain worse, so set a timer every hour to stand or walk for a few minutes. 5. Over-the-counter support. For some, acetaminophen or ibuprofen provides temporary relief, but don't overuse them. Talk to your doctor before making any medication part of your routine, especially if you're managing blood pressure, kidney, or liver conditions. These strategies won't cure a herniated disc or reverse nerve compression, but they can relieve symptoms, slow progression, and help you stay active. And for seniors, movement equals independence. Start small. Stay consistent. You may be surprised how much power you already have, right at home. Many seniors convince themselves that leg numbness or back pain is just part of getting older. But here's the hard truth. Ignoring these symptoms can lead to permanent nerve damage, and that means loss of mobility, chronic pain, and in severe cases, even needing a wheelchair. As we age, nerves don't heal as quickly. Compression that might cause mild discomfort in your 40s can become debilitating in your 60s and beyond. What starts as a little numbness or weakness can turn into muscle wasting, falls, and loss of independence. Studies show seniors who wait too long to seek treatment for sciatica or herniated discs face longer recovery times and a higher chance of surgery. Delaying care can also increase the risk of complications like bladder and bowel dysfunction, problems that dramatically affect quality of life. The good news? Early diagnosis and treatment, even simple lifestyle changes, can reverse symptoms or keep them manageable. Your legs are your foundation. Protect them before it's too late. As a doctor who works with seniors every day, here's what I want you to remember. Leg numbness and back pain are signals, your body's way of asking for help. Don't ignore them. My advice is simple but powerful. Stay active. Even gentle movement keeps your spine healthy. Maintain good posture to reduce nerve pressure. Listen to your body and don't push through sharp or worsening pain. Use at-home relief methods like stretching and heat to manage mild symptoms. Most importantly, see a healthcare professional early if symptoms persist or worsen. Remember, early action means better outcomes. You don't have to live with pain or fear losing your independence. Your legs carry you through life. Take care of them like the treasure they are. If you found this video helpful, hit the like button, subscribe for more senior health tips, and share this with someone who might need it. And if you want a free, easy-to-follow guide on managing leg pain after 50, check the link below. Your journey to stronger, healthier legs starts now. Thank you for watching. If you're serious about protecting your leg health and preventing sciatica or herniated disc problems, I've created a free, comprehensive guide just for seniors like you. Inside, you'll find easy daily stretches to relieve nerve pressure, nutrition tips to reduce inflammation, when to see your doctor and what questions to ask, simple lifestyle changes to keep your legs strong and pain-free. Click the link in the description below to download your copy now. No sign-up, no cost, just straightforward, trustworthy advice. Don't wait until numbness or pain limits your life. Take the first step today. And remember, hit that subscribe button so you never miss new videos on senior health, mobility, and longevity. Here's to your strong, healthy legs and many more steps to come.